we had a step forward yesterday, and quite a big step forward, just 16 cases recorded yesterday on Sunday, back to where we were basically in the days prior to that today. So 16 yesterday, up to 35 today. We've been saying, and the New South Wales government's been saying, of course, it is not just only about the headline figures of those 35. There are a number of things we care about within that, and what we know about those 35, well, more than half of them are household contacts of previous cases. We also know that a lot of these cases have been in isolation through their infectious period, and that is good to see. Let me show you this bar, this line here of the number of people out while infectious of each day's cases. We had, 20 of them a few days ago out in the community. Yesterday, a massive improvement to just 3 of yesterday's 16 cases having spent any time at all out in the community while infectious. And today we're back up to 11, so it's bouncing around a little bit. This is one of the key numbers. We want to see this line really drop to 0 and stay at 0 in order to be confident that this lockdown will lift. And obviously this lockdown's only got a few days, most of a week, but 5 or so days left before it's due to end. And so we're getting close to that point where the government will need to decide, are we lifting it or not? And this is one of those key numbers that will determine that. And unfortunately, I'm not going to put a percentage number on probability or anything like that, but unfortunately I do think that today's news has made it a little bit less likely than it was yesterday that we'll see that lockdown lift at the end of the week as planned. But as we have seen through all of these outbreaks, there's never any certainty in these sorts of things. Perhaps we'll find that increasingly these cases are household contacts. We might start to see some cases come from your day 9 and 10 of isolation tests coming in the next few days. People that have been in isolation for close to 2 weeks get tested toward the end of that period. They might start to test positive and create a whole new wave of cases. But this is one of those key numbers that we'll be watching.
Casey, why is there still some concern over the Brisbane outbreak related to a Portuguese restaurant?
Yeah, so that outbreak has just kind of continued to bubble along. It's actually looking better today than it has in the last couple of days for locally acquired cases in Queensland. And let's just bring up the chart of Queensland's local cases since May last year. On Saturday, there were a few cases that popped their heads up with no epidemiological link back to a known source. Today, Jeanette Young, the Chief Health Officer of Queensland, has said they're actually finding those links now. Some of those clusters, some of those unlinked cases are being kind of integrated back into the known makeup of these clusters. So that's good that this is being traced back and we kind of aren't seeing lots of unlinked chains of transmission, because that was the fear on the weekend. The other good thing that we're seeing is all of these cases coming through are alpha strains. So there are lots of clusters in Queensland. 2 of them were Delta strain of the virus. One of them, the Tanami mine worker. That cluster looks to have fizzled out. And the other one has momentarily escaped me. The hospital case, the 19-year-old person who worked outside a COVID ward, was a Delta strain carrier. They had been across a large part of Queensland. Thankfully, that one looks to, I don't know that we're 100% out of the woods yet, but looks to have fizzled out, and that is some other good news. So the cases are still grumbling along in Queensland, but good news is they are now being traced relatively well back to just a couple of clusters, the Portuguese flight crew one and the Greek centre is the other one that are genomically linked but are not yet epidemiologically linked. There's no known link, as in an individual person, that links the two.
Casey, we're also starting to get through some more data from the Commonwealth on vaccines in terms of state breakdowns, age, sex, and what have you found interesting about that information?
One other thing that we're finding with that, Karina, I'll just show you the national figures. We're actually seeing a lift again. We saw this flatline, this national number of doses a day really had flatlined through June. A lift again, 125,000 doses on average is what we're seeing at the moment. And I will be digging into some of that age data. We've only been getting it for a few days, so it's a bit early to see all of the trends that are coming out of that. But which age groups are getting vaccinated the quickest will be really interesting to see. What kinds of doses are they getting? Which brands of vaccine are they getting? And are we making progress in some of the highest priority groups, the older groups, and also, as we've learned today out of New South Wales, there are still a lot of gaps in Phase 1A around aged care workers and people that are coming into the system. There are 5 aged care residents infected in New South Wales at the moment, 4 of them vaccinated fully, The other one is not, and the reason they're not is because they moved into that aged care home after the federal government vaccination clinic had occurred, and so they haven't had the opportunity to. And how are they getting vaccinated? That's the kind of progress we'd like to see in some of that data.
Casey Briggs breaking down the numbers for us.